Inject to not infect. To start off, the coronavirus has been responsible for 2.4 million deaths. Not to mention, those of us who have managed to stay healthy have had to face other challenges, such as safely going to school or work, staying at home, and dealing with grief and other emotions. However, all of those can be a thing in the past with the COVID vaccine. In addition, the vaccine is ultimately made to help stop the spread of the virus. Not to mention, if we are all vaccinated, it would enable herd immunity, which is when a multitude of people have been vaccinated, which makes it harder for the virus to spread. Stopping the spread can of course stop the number of deaths, ultimately end lockdown, and eventually return everything back to normal. The Food and Drug Administration gave authorization to the first coronavirus vaccine, made by Pfizer and BioNTech, on December 11, 2020. And just 7 days later, the Moderna vaccine was also approved. To summarize, both Pfizer and Moderna are mRNA vaccines. mRNA means that it doesn't carry any part of the actual virus. Instead, it gives our cells instructions on how to form the spike-like structure, or S protein, from the coronavirus. Once the harmless S protein has been made, our immune system recognizes that it isn't supposed to be there, so it gets rid of it. Therefore, your immune system is being trained to get rid of the virus. Even though the COVID vaccine was developed quickly, Middle College High School's Health Career Collaborative Advisor, Tamara Storm, said, quote, "Scientists used information from the past 10 years, end quote. The government funded the research, inspiring scientists from all over the world to work together. In addition, the vaccine went through a variety of trials and phases before being released to the public. Besides, once you receive the vaccine, you will be monitored for 15 to 30 minutes for any sort of reaction. Afterwards, symptoms include pain or swelling in the arm, mild fevers, chills, fatigue, headaches, and muscle pain. Remember that after getting vaccinated, you should still continue to follow through with the safety precautions, such as staying at home and wearing a mask. In addition, one way to register for the vaccine is by signing up through Athena.com. When it's time to make your appointment, you will be contacted by email or through the app. Please arrive at the appointment on time and then set your second appointment for the second dose. Lastly, here's a list of all the resources that we use to provide you with this information. Thank you for listening, and we hope that you consider taking the COVID vaccine. This video was brought to you by Arturo Ayala, Eva Basilio, and Esmeralda Cueto Medina.